Hi. So we're starting the colon cancer awareness talk right now, and with me on stage we have Dr. Daniel Goldman. Dr. Goldman received his medical degree from Ross University School of Medicine and completed his general surgery residency at UPMC Central PA, followed by his fellowship in colon and rectal surgery at Thomas Jefferson University Hospital. Dr. Goldman's clinical interests include the robotic, minimally invasive management of colorectal cancer, diverticulitis, and other disorders of the colon and rectum. He's a member of the American Society of Colon and Rectal Surgeons and the American College of Surgeons and the Pennsylvania Medical Society. I'm going to turn over to Dr. Goldman.
Thank you for that introduction. Thanks for having me. As he said, I'm Dr. Goldman. I'm a colorectal surgeon here in central Pennsylvania, and I deal with all the sort of spectrum of colon and rectal problems, from cancers to benign problems, and preventing colon cancer, which is really, I think, why I'm here today. Probably hear me better without the microphone. No. But does anyone have any questions to start about colon cancer, rectal cancer screening? Yes, ma'am.
I just have a question as to how come different doctors have different procedures for your colonoscopy? Why can't it be the same across the industry?
Do you mean from a bowel prep standpoint?
Yeah. Yes.
Yeah. So there are guidelines by different societies for how bowel preps should be done. So in theory, yes, they should all be done the same way. In practice, certain physicians have been doing it for 10, 20, 30 years, and it's just how the way they do it. Some people follow guidelines, some people don't. They might say that they have experience and they just prefer that that's how their patients are prepped. It's just, any time that there's no one best way to do it, you're going to get variations.
Is there any research to find a better way to do this? Because that just wreaks havoc on your system. And why is it that some people use that color guard? Is that really good?
So that's a great question. So the Cologuard, for anyone who doesn't know, is a way to detect or find colon cancer that you can do at home. You basically have a bowel movement, put some of it in a box, and then mail it in, and they look for colon cancer. The problem with it is it's great at finding cancer, but it doesn't do anything to prevent colon cancer. Colonoscopies, we can remove the polyps before they become colon cancer, and so we can prevent colon cancer that way, instead of the at-home tests where you basically poop in a box until you get cancer. With the colonoscopies, we can prevent colon cancer. So that's a great question.
Okay, I have a question. It's probably twofold. One is, what is diverticulosis? Can you explain it to the group? And is the pouches that diverticulosis is that like the same or related to polyps you find when you do the colonoscopy?
That's a great question. So I'll start with the first one. Diverticulosis. Those are just pockets of the colon that form over time, many, many years and years and years. So they're very common in people as we get older. We find it very frequently when we do colonoscopies for other reasons like screening. As for your second question, they're not related to polyps. It's a completely different process. In actually the United States, a lot of the times diverticulosis, which are the pockets, and diverticulitis, which is the inflammation of those pockets, is more likely on the left side of the colon. The colon goes right, across, left. And in the United States, it's actually more commonly on the left side. In the eastern parts of the world, actually diverticulitis and diverticulosis is more common on the right side of the colon, and we think it has a lot to do with our diets and our habits. So it's a little interesting, but there is no relationship between polyps and diverticulosis. And most people that have diverticulosis never get diverticulitis. It's just the unlucky few that do get diverticulitis. The question was, how much fiber should you take in a day? I guess that kind of depends on your bowel habits. I have this conversation almost every day in the office. So if you have no problems, 1 to 2 bowel movements a day, you're on and off the toilet, no problems. Whatever you're doing is probably fine. If you have any problems with your bowel habits, I usually recommend 30 grams a day, which is a lot. It would be 14 apples a day. But for some people, this is actually life-changing. And I do speak from personal experience without giving you guys too much information, is that if you do have any problems, I would probably be out of a job if everyone had 30 grams of fiber a day, which is fine. But yes, and water. I take a fiber supplement that probably gets me about 20, and that works perfectly well for me. But anyone who comes to see me with any problems, I start at 30 and then kind of let them self-regulate and figure out on their own what works for them. The easiest way to get fiber, that's a great question, because I have people come to my office all the time and they have problems having bowel movements, they have problems with their anal area, but they're like, oh, I eat salads and fruits. And like I said, you'd have to eat 14 apples or 12 kiwi with the skin on to get enough fiber. So personally, I think the best way is to get a fiber supplement. Doesn't matter if it's a pill, powder, gummy, name brand, generic, cheap, expensive. The ones I find revolting, my wife uses. The ones that she finds revolting, I use. So, there's many different types, but a fiber supplement is probably the best way if anyone has, issues. I'll be honest, I don't think the best one to use is whatever works for you. I use the cheapest CVS powder. Yes, cheap is good. I use the cheapest CVS powder because I'm going to take it every day for the rest of my life, and that could add up. My wife, she uses the expensive gummies. So whatever works, there's some like orange flavored ones that my nurse practitioner uses that just sounds awful to me. Yeah, see, she likes it. Yes. Yeah, psyllium husk, exactly. Yeah, psyllium husk, yeah. But the orange flavor, like, that just seems awful to me, but she likes it, so rock on. I use it, it's flavorless, but it's a little sweet, so to me it's just like chugging iced tea. So whatever you will take that doesn't make you nauseated. What's that? Yeah, those get expensive, and I speak from experience. Use the generic ones. You don't need the name brand ones. Yes.